We have been working very, very closely with the superintendent and all their staff, including their environmental staff, in terms of the cleaning of the rooms and a lot of details. I mean, we've been working this for the past month. They will be wearing their masks in school. They will be maintaining their distancing. New ways of making sure that they clean every day, the touch surfaces going throughout the school and cleaning and taking care of all those things. There is an assigned desk chart for each classroom and for the bus, so that when we do contact tracing, we know exactly where the kids are. That is very, very important. I do not expect to see a lot of positivity in terms of the school, the elementary, middle, into the high school. We start getting with the seniors as they venture out to do the things that we tell them not to do, that they will do. And of course, the universities. That's where we're seeing our large number of positivity. Not on campus, but when they go off campus. And especially Palm Beach Atlantic and FAU are very concerned about the cities right next to them, where despite all their efforts to tell their student body to behave in a certain way, when they go out into the city, whether it be Delray, Boca, or West Palm Beach, they see very bad behavior. So the schools are trying as best they can to try to keep the campuses safe, but you know, it's the what we get from our contact tracing is it's either the clubs that they're going to, or the house parties, or what's very popular now is the gathering at parking lots at night, late at night, and then having tailgate parties. So they have found a new venture to be able to gather and have fun. So we got to keep all those things in mind.
If we find ourselves with a cluster in one of the schools, do we have a mobility team that can go in there and address it so that we can?
Yes, we do that on a daily basis. Even before we had COVID, we do that all the time. Norovirus, for example, that's something that's going on now that we need to be able to report. So in addition to COVID, we also have everything else that we have every year. So the schools are very used to handling that and working closely with us. I'm glad to say that as of now, with the private schools, we have not had any secondary cases, because we go in very quickly, send the kids home for quarantine, get tested. So we should see the same thing happening through the public schools. And you know, we're going to be working very, very closely with them through this whole time.
Okay, and I know they've admonished the parents that if a child has any sort of symptoms, to keep them home.
Yes, and when they get to school, the moment the teacher or anybody or the child themselves feel ill, they will be taken right over to the nurse. The nurse will make you know, their inspection as they usually do, and they also have the ability to telemedicine with some expert pediatricians to help them in terms of whether or not they think it's COVID.